So good morning. Thank you everyone for signing in. I'm Lee Crocum from Capital Sales. As always, we have a lot to cover, so let's get started. If you have any questions, please put them in the question box and we'll take as much time at the end if needed of the webinar to answer questions. And we may answer a few questions during the webinar. Make sure that you get them in the question box there. We have Leon Tsinberg and Jonathan Ferry from Key Digital, and they'll be showing us how to reduce harmful staph exposure and increase patient care with Key Digital's medical monitoring system. So Leon, please go ahead.
Thank you, Lee, for the opportunity to present here. And thank you for pronouncing my last name correctly too. Tsinberg with the T and the S sometimes has difficulty with pronunciation. So I want to thank you for that and welcome everyone to my webinar. I did one of these, I'd say probably about a month ago on AV over IP. What we're going to discuss today is going to be actually based on that core technology in part. So what we're looking at here is the medical monitoring system. This is the perspective of the system from the nurse's or doctor's station. On the left side, you'll see the controller, right? So you'll see different rooms numbered 1 through 16 on the far left screen. And then on the right part of that far left screen, you'll see how the camera control is integrated. So if the nurse wants to zoom in on patient number 2, she would press number 2 there, and then she would use the PTZ function of our control. Oh, excuse me, sorry about that. She would use the PTZ feature on the right side of the screen to control the zoom. Now, this system is bidirectional. Meaning and we'll get to the patient's room, but the patient has a button there, a help button. When that button is pressed, that room lights up. So and then the nurse can immediately select it. So she'll see that, room 2 needs assistance. She'll select that, she could zoom in on the camera, and then she'll be able to talk to the patient back and forth live without necessarily going into an exposed room. So one of the benefits we have here is not only COVID, but post-COVID, this is an enhanced experience for, hospitals, nursing homes, clinics. It doesn't just have to be a large medical center. It kind of goes one step above, just the regular help button. So, I know, unfortunately, I've been to the hospital recently where you press the button and then the nurse comes in 15 minutes. But here, it's a little more reassuring to know that someone's watching immediately and can immediately get on the horn, so to speak, using our AV over IP system.
Yeah, and Leon, if you don't mind, I'd like to just chime in here, which is, as we've been part of these meetings, as you, our integrators, have contacts with maybe hospitals, or as Leon mentioned, it might be elderly care type facilities. And we've been part of these meetings in web, or even sometimes in person here on the East Coast near our offices. Well, the system came about out of necessity because of the COVID-19 global pandemic. But honestly, we're hearing a lot from the hospitals and whatnot on just how to say this the correct way. Sorry for stuttering on this, but basically they want to use the nurses. They want to increase how many patients can be managed per nurse to increase the efficiency of the hospital staff themselves. And so it might be a bottom line incentive by the hospital, or let's just say that right now, as we know, that a lot of people are leaving the healthcare industry because of what's happened here. And so they might need to invest in a technology that allows each nurse to do more. So kind of two sides of the same coin there.
Yeah, so what we're doing, thank you, Jonathan. What we're doing here is we're basically selling the kit. You're going to get the controller built into a computer. You're going to get, and we'll get into the components in a second. One other interesting thing to go off what Jonathan just said is there is an ROI, return on investment, to the hospital for this system, primarily in insurance for them. We've spoken to doctors who have indicated that one of the biggest liabilities hospitals face with patients, COVID, not COVID, is the patient trying to stand up and falls right there in the room. That's one of the biggest sources of liability. So again, being able to monitor them can also have it can also dampen their insurance exposure and can actually turn out to be a system that saves them money in the long run. Even though they spend money installing the system, there would be insurance benefits for both the doctor and the hospital on that. Let's get into it a little more technically now. So the system is based on an Ethernet, not an internet. Having said that, we also have a court system we created, which utilizes actually the similar kind of system. The system can be connected to the internet, but it doesn't have to be. So if they're concerned with privacy, then the system is fully closed loop Ethernet. You know, it does not have to be connected to the internet. The only way this would make sense to connect it to the internet is if they want to encode, like do a soft codec on a Skype. God forbid, you know, in the last hours, the patient wants to connect to their loved ones, God forbid, something like that. But generally speaking, it's closed net and completely private. All you need is one Cat6. So some of the pushback we've received from hospitals has been, how does this interfere with our IT department? You know, that's a big concern because they don't want any interference on their own internet systems. This will not interfere with the internet system. It's a separate system. You know, most of these patient rooms have an arbitrary Cat5, Cat6 wire going there for back in the day when people used to plug in for Ethernet. It's unused. It goes to a back room, to the closet, and into a network switch that hasn't been used in a decade. All you got to do is replace that network switch with our equipment. The wiring is done in 99% of the hospitals. So we're just piggybacking off of their existing wire without interfering with their IT system. That's an important point for some hospitals who need approval from their IT department to do this. The video uses 1080 PTZ camera at each bed. We'll get into the equipment in a second, but it goes in multiples of 4. So from the nurse's station perspective, and that's because of our MLV 4x2 product, which is one of the backbone products in the system. But you could do 4, 8, 12, 16, any multiple of 4. I believe it can go up to 256 on one system, or maybe 252. But one system can be quite large and can accommodate a big wing for the medical center. The audio is going to piggyback off of the also the AV over IP. The A part of it is the audio. So you're going to have bi-directional USB speaker and microphone combination. It comes as one unit. And again, they'll have that help button, which uses a trigger on the AV over IP to tell the control system and the viewing nursing station patient 4 needs help. So a big red frame will go over that room, and then using the control system, you can make it full screen. So on the audio side, you have bi-directional speaker and mic. Now, I've been asked on this, in light of COVID, what kind of sanitation precautions are taken for these microphones. And it's actually very simple. You put a little baggie over the microphone, and then when the next person comes in on the next shift, they discard that little baggie. It doesn't interfere with the USB microphone. Okay, finally, you have the camera. The camera, I forgot the exact luminosity, that the minimum luminosity it requires, but it's very low. So at night, the patient can sleep comfortably with just a very minimal amount of light in the room, and the camera can still watch him. The camera can also be put into privacy mode. You know, in the event they need to change the patient or something like that, where the camera will physically turn around and face the wall. So it will deactivate the feed, and the patient can be assured that the camera is not looking at him or her at that time. Okay, so from the perspective of the nursing station, this gets into our equipment. By the way,
Hey, Leon,
yes.
sorry,
Sure.
the camera, just wanted to chime in. The camera specification is a minimum illumination of 0.1 lux,
Lux.
which is equivalent to full moon lighting.
Okay, do you know the lumens on that, Jonathan?
Ooh,
Or we can
lumens.
get back to it. We can go, you know, I think it's on the website. There is a minimum luminosity there as well.
Yeah, minimum illumination, 0.1 lux, but it doesn't say, I don't see anything specifically as to what you're asking though. Yeah, we have it all the specs are on the website, and we could even point people in that direction after the meeting here.
Absolutely. Okay, so in terms of the actual hardware, this is actually good to understand not just this system, but our AV over IP systems in general. This type of system actually encompasses what I take on the road as a demo. Because when you combine AV over IP with the MLV 4x2, so you see the IP922 decoder feeds into the MLV 4x2, what you're essentially doing is you're generating a virtual video wall. If you took the MLV out of this equation, those 4 units would be able to go on 4 monitors and create a video wall. But since we want those feeds to go on 1 monitor, then the MLV, essentially it's a tiler, but it creates a virtual video wall tiling system within 1 monitor, if that makes sense. But this is also very good to demo on the road for customers who are just looking to create a video wall, but you want to do a quick demo with 1 display so they understand how a video wall would function. But that's a little bit of a digression. Overall, our AV over IP system uses a verified network switch, as you can see on top. It's important. Jonathan will have a heart attack and then he'll wind up in the hospital. Then we have to monitor him if you don't use a verified network switch. So please make sure you use that switch from the list. Why? Because maybe a non-verified network switch could work in the beginning, then 6 months down the line, the whole thing fails. So we highly recommend you look at our verified network switch list when you're speccing in these systems so that we can ensure that these systems work for years and years and years. Those switches have been on in our lab for years. Literally, we do not turn them off. So what's on our website, just use those. I don't want to beat this to death because
Well,
it's just...
and Capital Sales has a great brand, 2 brands at least, that out of the 11 different manufacturers that are on that list, Dealing for Business, Luxol are 2 that I think of that Capital is offering. Please correct me if I'm wrong, guys. But overall, and remember the medical monitoring system. So Leon's referring to our AV over IP, where you know, you just for traditional projects, video distribution projects. But for the medical monitoring system, this is actually included in the price of the kit itself. And we are including the appropriate network switch as part of it to be a turnkey.
Absolutely, yes. Everything you see here comes as a kit. So the microphone, the speakers, the switch, we can always work with Capital Sales if we need to put in a different network switch, correct, Jonathan, based on those SKUs? I'm sure that shouldn't be a problem, but I'm not the engineering department. Anyway, so the basic system, if we're looking at 4 patients, would be 4, let's say, IP922 decoders. That's feeding in from the sources coming from the patient room. That feeds into our tiler or multi-viewer product, the KD-MLV 4x2 Pro. And then again, what that's doing is it's creating a virtual video wall. If you take a look at the bottom right-hand corner near the nurse, that's the control system. It looks like a computer at her station. from that computer, she's able to do the controls we were talking about: zoom in on a patient, tune in to the audio on the patient, move the camera around, etc. So all those functions are right there. Okay, again, increments of 4. So because the MLV 4x2 is a 4 tiler, it tiles 4 images, these things work in increments of 4. So if you take a 16 unit here, 16 different patient rooms, you have 16 decoders on the right. You could see the KD IP92 decoder. And then you have 6 MLV 4x2 Pros. So if you keep doing the math, you could figure out that we could stack these as big as they need to be stacked. And furthermore, with the MLV 4x2, you can actually not only tile it on one monitor, you can tile it on multiple monitors. So, you know, depending on how many patients they need at one particular station, the MLV 4x2 is flexible in the sense that it also gives you 2 outputs. So, you know, there's a lot of flexibility there in terms of you can even build out, let's say, a 2x2 video wall and then do 16 times 4 type of system and have it display on 4 monitors. So the sky's the limit. And, you know, it looks like a lot of equipment, but the truth is, for what they're getting, it's relatively cost effective. We're not going to get into price on this presentation, but these systems, although lucrative for the installers and very good jobs by any means, from the hospital's perspective in terms of how much money they're saving on staffing and insurance, it pays for itself, you know, many times over. So from the patient room perspective, the patient has a help button. That help button uses a trigger that goes into our IP92 encoder. The encoder is always the one responsible for taking the sources, and the decoder, the DEC, is the one that's responsible for going to any monitors, or in this case, the multi-viewer. But the IP92 encoder receives a trigger command from the help button, which gets routed through the AV over IP system and then produces a response at the nurse's station that says, you know, patient 2, press the help button. So they'll see a big red frame go over that person's room. You have the camera. The camera does come with a mount kit in the box. So however you want to mount it, be it on the ceiling, above the TV, on the wall, whatever it is, the mounting equipment comes in the box with the camera. You have a USB microphone and speaker. All of that travels to a mini PC acting as a soft codec, which will convert it into HDMI and push it through the AV over IP system. Again, it looks a little bit complicated, but at the end of the day, just pay attention to the connection between the KD IP922 encoder and the network switch. It's one cat cable. I believe the limitation on it is 300 feet, so it should be enough for one floor. Depending on the resolutions that you set, the distance can be increased a little more, and I believe you can daisy chain them with multiple network switches as well. But this is the basic perspective of the patient room. Jonathan, actually, let me ask you a question. I know we had some emails go back and forth about the actual medical equipment that uses USB. I know we had questions as to whether or not that can go through the AV over IP system. Do you know anything about that while we're looking at the patient room here?
Yeah, the USB equipment, the camera and the mic speaker combo. That kind of data is not supported over the AV over IP product. The AV over IP keyboard USB ports are used for keyboard and mouse, but it's not supporting the bandwidth of things like a webcam and the mic speaker combo. So we actually, so that's why we're sending it into our KD RM PC, the remote management PC, to have that camera feed go out as an HDMI, but also for the audio, how do you have the USB input of the microphone to the PC? How do you have that go out over HDMI, right? If you think about that, that's not traditional. So we've actually, one of the hidden layers, if you will, or under the table kind of things that is behind the curtain, I should say, is we have actually, this system also utilizes, our engineers developed an audio over IP server client software that we get the mini PC on the network, and we're able to take the audio as a client from the patient room to the server, the nurse's station. So that's kind of how we're handling those USB devices.
Thank you, Jonathan. Yeah, I believe that because that's a common misconception on the IP922, since it has a USB input. Correct me if I'm wrong, Jonathan. I think the bandwidth limitation on it is limited to 512 kilobits per second, if I'm not mistaken. Something in that range.
Yeah, I couldn't say. I'm not sure. You may be right about that, Leon.
But basically, the idea was it was designed for KVM basic data applications. So that's something to keep in mind. But again, you can utilize the USB functionality to push data through these AV over IP systems. Some common examples of that were touch screens are able to be shot through the system, keyboard, mouse, KVM. So you're free to check with us on localized data transmission utilizing this system and utilizing the USB inputs on it as well. We're happy to look into customized jobs for that, because some of our clients asked about whether or not they could drive certain medical devices through this that do have USB out, and whether or not we can replicate that data on the opposite side with the nursing station. So to be honest, I'm not clear on the answer on that, but my understanding is as long as the bandwidth requirements are within the range, it should be okay. But you could check with us on that. We've had a few hospitals reach out to us, ask that question, especially that like cardiogram machine and stuff like that. But on the AV side, again, you have the camera, and then that's going to feed, and then you have the help button, you have the USB microphone and speaker into the mini PC. It's all going to feed into the AV over IP system, which will ultimately go back to the nurse's or doctor's station. All right, not that much today on the MMS system. These are your sales representatives. Jonathan, for some reason, is hidden here. I guess he doesn't want too much tech support call, but you can find his information on the website as well. My information is here. If you guys need anything, please feel free to reach out to anybody on our team, and we're more than happy to help. With that being said, I'll open the floor to any questions and Jonathan's inputs. Jonathan?
Yeah, Leon, thank you. And in fact, we do have a question. Okay. That has come in from Rob. Thanks very much, Rob. The question is the mini PC management a key digital part? If not, what is recommended? And Leon, if you don't mind, I'll just answer this one.
Go ahead.
But so Rob had actually utilized the SKU that we are using for that. It is a key digital part. It is KD-RMPC. However, you might not see that, although we are utilizing that in projects now, it hasn't been a piece that we have put on our typical price sheet yet for individual purchasing. But it's not a product that Key Digital is manufacturing. It's what we are doing after the the aftermarket stuff that we're doing that is making it special. We are loading it with Key Digital software. Key Digital has a very robust set of software from our Key Digital management software that you've seen, that is what we use to configure our AV over IP systems, for example, our matrix systems, our presentation switchers. You guys have seen the Key Digital management software for quite some time in these presentations that we've done over Zoom with you guys. And we have now our KD cam control that we'll be releasing public here in the next few days, in fact. that is a way of controlling our PTZ camera over the USB without any IR RS-232 cabling, and even being able to use it as a preview of sorts. And we have and then we have the management software for the nursing system, and we're also developing a courtroom system out of a similar technology. So it's loaded with the Key Digital software that is the perfect fit for managing these systems, kind of as a, you know, one almost like a control system would do without any programming whatsoever. And so in addition to the Key Digital aftermarket stuff, this is an Intel Celeron 4 gigabit DDR processor using Windows 10. It's a 64-bit machine. And so we've gone through a number of these mini PCs and kind of found the right fit for what we need connectivity-wise and software-wise. And again, you'll see this more in the future from us, Rob, under the SKU KDRMPC. But just to emphasize one last time, this is a kit that is sold as a whole here. The mini PCs, even the USB speaker microphone combo, this is a kit that we're going to be able to sell. And, Key Digital's deeply involved in this kit. We've shown the generic 4-patient system and 16-patient systems. In actuality, everyone that we have truly deployed has been a custom fit solution. We had one with 8 patients, audio and video, plus 18 audio only, for example. And what that requires is, a good amount of discussion between Key Digital and the integrator, and sometimes the end user, as I alluded to earlier. And it also then requires, once we collect that information and finalize the kit price for that specific kit, because everything in our industry is custom, as much as you try to build these cookie cutters, of course. Then our software engineers develop the PC software that is, again, a perfect fit GUI for this system without any programming at all from any control system. So it's a PC software to do everything and do all of the audio over IP stuff and video over IP. So that was kind of a long-winded answer there, Rob. I hope that gives you the information you need, though. Any other questions, guys? Please feel free. Don't be shy. If it's on your mind, it's probably on someone else's mind as well.
Well, I wanted to say I really appreciate your time, everyone, on this. If you do have offline questions, you have the email addresses right there, the phone numbers. Again, feel free to reach out anytime.
Yep. We'd like to thank you all for attending. Thank you to Key Voice, Leon and Jonathan, especially for presenting. Please feel free to reach out to your account manager at Capital Sales, Key Digital, for more information. And as always, we appreciate your business. Thank you.